Okay, joints. One of the major part and component of the animal skeletal system after cartilage bone mutation. No skeletal system can give flexibility to move the animal and to do other maneuvers without having the proper joints and articulation system. So in this lecture, we are going to discuss what the joints are, how they are formed, what are their significance, and how many different types of the joints exist in the animals. So let's start quickly. The joints are basically the weakest points in the skeleton, and it is a point where the two or more bones join together and have ability to articulate at that point. The main function is to provide mobility and flexibility to the skeleton that supports the animal movement and locomotion. So these joints work as the fulcrum and or the pivot system where the one bone revolves around the other bone or flexes around the other bone or any other movement. And this basically changes the direction of the force the muscles are exerting on the bone. Right? So imagine when you lift something up from ground, you are basically putting force. Your muscles are putting force only in one direction, that is contraction, whether they are pulling some bone or uh, pushing some bones, right? But how you can move in the different directions? You can lift up a box and put it on the table, or put it in the boot of your car, or at a different position. So this is all because of the joints which alter the direction of the force exerted from the same set of the muscles. Right? So this is the significance of the articulations. So we can divide the joints into three different categories broadly, depending upon the two criteria. The first criteria is in type of the joint movement. If they are the freely moving joint, where the one bone can move freely around the other, we call it diarthrosis type of the joints. If it is not fully freely movable, it is slightly movable. It can only slip a little bit or can just give a limited movement. They are called amphiarthrosis joints. And some are the joints where the two bones are basically fused together or fixed so strongly, so strictly that they cannot move or they are immovable. Such joints are called synarthrosis. Right, so this is the first criteria depending upon the ability to move or the limit of movement, flexibility. The second is the type of the structure of that bone. If it has the fluid filled bone joints, they are called synovial joints. If they have the fibrous fusion of the bones, or there are fibrous joints of the two different bones like a stitching together, they are called fibrous joints. And if they are cartilaginous type of the joints, where the cartilage is providing the gluing material for the two bones to join together, they are called cartilaginous joints. Right, so these are two basic criteria depending on which we can divide articulations or the joints into three different categories. So let's start with the synovial joints. They are the most common type of the joints in the shoulder, in the hip of the animal. Ball and socket type of the joints are the most common example. Within the hand, the knuckles, they are all synovial joints, where the joint is covered with a specific membrane, and that membrane forms a capsule that is filled with a fluid that is called synovial fluid, and this synovial fluid provides the frictionless movement of the bone. So they are basically free moving, so we can call them the diarthrosis type of the synovial joints. So this is the close up of your finger knuckle, where you see that the ligaments are present to support two bones. Then there is a covering of the cartilage around the edges of the bones to avoid friction and damage to the bone. And then this is the cavity. This is the membrane, the red fibrous synovial membrane. And then there is a liquid within this capsule that is called synovial capsule. Now, there are six types of the synovial joints which are classified by the shape of the joint. So, synovial joints could be of six different types. So, they could be gliding, right, like present in the few vertebrae of the neck, which provide the ability to glide the two bones on each other. They could be hinge-like in your elbows that have only one directional movement, only flexion or extension. It could be pivot-like joints in the neck, basically where the skull is joined to the spine and it provides a pivot one point attachment, and head can move in the 360 degrees in one direction, in one plane. Okay. Sorry. Then the next type is the condylite type joints, which is present in your wrist between the radius and carpal bones. An example of the condyle joints where the bone has a limited ability to move. Then the saddle joint, again in your thumb, that has a saddle joint which can make it possible to move in two different directions. And the most common one, ball and socket joint in the hinges or in the shoulders. Right, so these are all the 6 different types of the synovial joints. Then comes the cartilaginous joints. They are basically slightly movable or sometimes immovable. Right? So the bones are attached together by the help of the cartilaginous fusions. So most commonly slightly movable, present in the intervertebrate discs, right, or in that ribs and sternal area, and some other major joints in the pelvic region. There are two types of these uh, cartilaginous joints. The one is called synchondrosis. It is immovable cartilaginous joints. One example is the joint between the first pair of the rib and the sternum. So they are basically not movable at all. The second is called symphysis, that consists of the compressible fibrocartilaginous pads that connect two bones. This type of the joints allows some type of the movement of flexibility, but they are not very freely movable. Right, so these are two different types of the cartilaginous joints. And finally, there are fibrous joints where you see the stitch-like structures in this zoom in figure diagram. So in the skull, these type of the joints are present in your gums where the teeth are attached to the jaw. They are fibrous joints. So they are totally immovable, synarthrosis type of the joints. There are 3 types: the sutures. These are the moving and non-moving joints that connect bones of the skulls. The second one is the gymphosis. These are the type of the articulations between the teeth and the mandibles or the jaws, and they are again immovable and strongly withholding the bones together. And third one is the syndesmosis, is a joint in which the ligament connects two bones, allowing for a little movement. Amphiorthrosis, the distal end between tibia and fibula. Right, tibia and fibula, they are basically bound together with the fibrous cartilage to give a little bit movement, a slight movement. So these were the 3 types of the fibrous joints.